Desde hace 6 años, el profesor Joachim Schulze, que no sé si se pronuncia así, pero así ha quedado, trae sus alumnos a nuestro congreso. Y durante todos estos años, cada una de las sedes ha hecho un esfuerzo o un intento de poder explicarles, para los que nosotros llamamos los austriacos, el modelo austriaco, cuál es el modelo de sanitario español en sus diferentes modalidades, cómo es la atención primaria, cómo es la atención hospitalaria, la atención en diferentes formatos, ¿vale? Y durante 6 años ellos han sido receptores de lo que nosotros hacemos. Y el año pasado pensamos que esto tendría que ser un intercambio, que no podía ser que nosotros siempre les contáramos a ellos lo que nosotros hacemos y que no supiéramos nada tanto de su sistema sanitario como de lo que es la enfermería en su país. Y invitamos a Joachim Schulze a que nos presentase lo que era la salud y la enfermería y la investigación en enfermería en Austria. Joachim Schulze nació en Alemania, pero lleva en Austria desde el 2009. Está registrado como enfermero desde el año 1990. Tiene estudios académicos en enfermería, en gestión de salud, en salud pública, en filosofía, sociología y macroeconomía. Toma ya. Todo eso lo obtuvo en la Universidad Luterana de Nuremberg, en Alemania. En la actualidad es profesor de Ciencias de la Salud y miembro del grupo de investigación del Departamento de Ciencias de la Salud de la Universidad de Krems, en Austria. Trabaja en campos de formación y en investigación en el nivel en los estudios secundarios, en lo que sería segundo grado. Y también tiene experiencia de haber hecho formación en Estados Unidos, en Minnesota, y en Alemania y en Finlandia. Y yo, sin más, y esperando que todos podamos aprovecharnos de lo que nos pueda contar, le doy la palabra a él para que nos explique cómo es la salud, la enfermería y la investigación en enfermería en Austria. George.
Well, thank you very much, Maite, for this very kind words for beginning. But first of all, I would like to ask you, because I had no interpreter in my ears, translating your words.
Yeah.
My speech is in English, and I hope you have the chance to be translated from English into Spain.
Yeah. All people have English.
Yeah, but I cannot see the interpreters. I hope it works. If you have your iPhones in your ears, can you hear the translation? No. Maite.
The problem es que no veo ni a los traductores. ¿Alguien de fuera puede mirar a ver dónde están los traductores?
Well, in English it's part of our job to solve problems.
Por más que tosa no van a aparecer, ¿verdad? Me parece a mí. Sí sé que ha ido alguien a buscarles, pero mientras vienen podemos hacer no sé qué.
Maybe they started lunch before us, so we could meet them at the restaurant area and go on later.
The problem, Joachim, is the translators are not there. I cannot see people translating. There is empty.
Yeah.
Someone is looking for them. ¿Qué? ¿Te vas a venir a traducir conmigo? Siéntate aquí, sí, siéntate aquí, siéntate aquí. Okay, a problem, a solution.
Yeah.
We will try to translate you. Just
Half.
it's not simultaneous one, but between the people is arriving, and we hope they will arrive in a moment of this conference. We will have a translated.
Person sharing. We could do it simultaneously.
Consecutiva, eso que se llama. Mientras vienen los traductores. Hala, Pilar.
Well, it's just half an hour.
It's half an hour only.
Okay.
Bueno, esto está sin preparar, lo siento mucho. No sé si me va a dar para traducirlo todo.
Okay, so we could do this speech together, okay?
Yeah.
Yes, and I will talk very slowly.
Okay.
So that you can understand everything. So, thank you very much for choosing this session, and it's part of our job to be very flexible. And Maite, thank you very much for invite us, our country, to this 18th International Conference.
Muchas gracias por venir y muchas gracias Maite por invitarnos y por tus bonitas palabras en la introducción.
Yes, we have a part of history together, professionally.
Tenemos.
No. Yes, the first visit.
Comenta que tiene una historia.
The first visit here in Spain from the Austrian side was in. I haven't heard if you mentioned this in the Spanish introduction, but 2009 we had the first year where we came with a group of students from Austria to Spain.
Llevan varios años viniendo desde Austria a España con un grupo de alumnos.
So, and now we have 2014, and it's our 6th conference here where we could participate. Thank you very much for that.
Es la 6ª vez que pueden participar, si no lo he entendido mal. Y nada, y agradece esta oportunidad.
So, last year, Maite asked me she would like to invite Austria as a guest country for this international conference.
El año pasado Maite les preguntó si podían participar como país invitado este año.
So, from that side and from the side of our country, thank you very much for this very, very kind invitation. Thank you so much.
Y agradece de nuevo por esta amable invitación.
So, back to the title on the slides. I would like to talk about healthcare, nursing, and a little bit about nursing research in Austria from the past to the future, and this in only 30 minutes.
Quería hablar del pasado al futuro, tanto de la enfermería como un poquito de la investigación en enfermería y también del sistema de salud de Austria, y todo eso en 30 minutos.
The reason is because we have in our country a situation with big changes, and it's very we want to shift the nursing sector to the higher education level in different parts, and due to this we have lots of problem-solving situation, and we want to tell you what we think about that, and we want to ask you and all colleagues in the rest of the world, what do you think about we could do?
La situación es que el país está pasando por muchos cambios y entre ellos está el cambio en el sistema educativo, cómo está pasando la enfermería a nivel educativo superiores.
So this is also why we came over 6 years with a group of our students here to visit the conference in Spain, to collect information and to come and to discuss with colleagues from all over the world.
Y esa es una de las razones por las que han estado viniendo un grupo de profesores con alumnos, para conocer otra forma, otras situaciones y coger estas ideas y poder discutirlas después ellos en Austria.
So it's an honor for me to present you our country. Austria is just in the middle of Europe. You can see this here, the red circle here, very in the middle of Europe.
Creo que no necesita traducción, ¿no? Aquí está Austria, justo en el centro de Europa.
We have 9 provinces or regions in Austria, and all these provinces and regions have their own government, So we have a national parliament and laws and regulations, but we also have a little bit like Switzerland. Is a colleague from Switzerland here? They have the same situation, or a similar situation. So we have 9 provinces.
La situación política es algo parecida a la de Suiza. Tienen un parlamento que es nacional, pero dentro del país hay 9 provincias y cada una de las provincias tiene su propia forma de gobierno, como se llaman un poco los cantones suizos, ¿no? Entonces tienen la regulación tanto la nacional como la de cada una de las regiones o provincias.
Well, we come with the group here from the Austrian side from this region. It's called Lower Austria, and you can see that the size is one of the biggest regions in our country.
Vienen de la zona que ha señalado, de la zona baja de Austria, y bueno, ha señalado las zonas que incluye, ¿no?
So we are a very little country, a small country with lots of space, and this space goes up. We have high mountains in the middle here. The most space in Austria, there we have mountains. Here in this region in Lower Austria, we have not so high mountains, but it's a very world famous area for wine. And yes.
Bueno, pues comenta que el país no es un país muy grande, pero sí tiene mucho espacio, muy montañoso, y
White
una
wine.
zona muy importante por su vino, ¿no? Por su buen vino.
Yeah, and the Spanish has also very good wine.
Los españoles también
Yes.
tienen buen vino.
We arrived on Monday and we had some. Looking to the lunchtime and the wine discussion. In this area, I will show you a slide. It's a very well-known area. It's World Heritage, and it's called Wachau. And it's about 70 kilometers distance to our capital, Vienna. And another card here, just on the top is Germany, Switzerland here, Italy, Slovenia, Hungary. So we are very in the middle. And our university where we come from is from a little village. It's called Krems. And
Esta es la zona de donde ellos vienen y está como unos 70 kilómetros de la capital.
this is not Krems, but this is the highest mountain in Austria. It's called Großglockner, and it's 3,798 meters.
La montaña más alta de Austria, 3.798 metros.
I hope I'm right. You can interrupt me, but I think we have more than 50 mountains higher than 3,000 meters.
Higher than 3,000.
More than 50, yeah.
Más de 50 montañas más altas de 3.000 metros en el país.
So if you think about Austria, many people first think about this mountain area, and they're going for skiing during the winter season, and or mountain biking downhill.
Cuando piensas en Austria siempre piensan en estas montañas y lo típico, ¿no? La gente que va en invierno a hacer esquí o a bajar las montañas con la bicicleta de montaña.
So, some basic facts to our country. The population is about 1.5 million in total, the whole country, all regions.
La población son 8,5 millones.
The capital city is Vienna, and there we have actually it's a very brand new number, 1.75 million inhabitants.
La capital, Viena, tiene 1.750.000 habitantes.
Well, and the highest mountain I mentioned before. This picture is another area, and you can see a totally different view to Austria. This is this kind of wine region. It's called Wachau, and it's pretty nice. And our university is just in the middle of the wine mountains, so it's
Esta
very
otra
nice.
zona, como podéis ver, es la zona donde vienen los vinos tan buenos que vienen de Austria. Me comentan que ya tenemos los intérpretes profesionales, así que me retiro.
Thank you very much for your flexibility. It was great. Perfect. And I welcome the colleague over there. Okay, hello. Okay, let's go on. I want to introduce the area where we work. It's not a huge city like Vienna. It's a very small city in this area, and it's called Wachau. The population is about 25,000 inhabitants, and the name of the province, it's one of the 9 provinces, is Lower Austria. And this is not typical for skiing or doing winter sports, but another art lifestyle. But some facts related to public health in Austria and their healthcare system. And this is one of our topics or in scope when we want to come in contact with colleagues from all over the world. And also, this is one reason why we want to come to Spain since 6 years. I will show you, I hope you can see this. I have another chart where you can see the lines a little bit better. To compare the countries Austria and Spain, the Spanish population is much higher, 55 million. But if we look to statistics and to data, you can see from the Heidi tool from the European Commission the proportion of in percent from smokers between the age of 15 and 24. Spain, the number is the proportion in percent 26.0. The Austrians, the same age, 29.4. This is one aspect, and it's a kind of self-reporting. So we have, I think, much more in this case. So you can see this here on this slide, the Austrians, in many slides and in many figures, we have the red color. So that is one issue here. Another, alcohol. I talked about the wine region. Alcohol consumption among population aged 15 and over. The target group here, young adults. And if you look to the right side, your first view is the Austrians are on the top in Europe with alcohol consumption among the population. About, I will show you another slide. The Spanish population in the same age is a little bit lower. If we look to this, you can see in these 2 lines the life expectancy from birth. And I can tell you the blue one is the better one, and this is the Spanish line. The Spanish people live longer than the Austrians, and 1.5 years longer. On another slide, the proportion of persons reporting diagnosed high blood pressure in the past 12 months. And I will give you the slide to this. The Spanish people have lower blood pressure. So Austrians also have a problem here in this case. Another fact is, if we look to other sources, the Spanish length of stay in hospitals is on average 6.8 days. In Austrian hospitals, 9.0 days. So, some questions. The people in Austrian hospitals have a longer stay than the Spanish. We have more alcohol consumption. We have more younger people smoking, etc. pp. Looking to another fact, to the number of beds in Austrian, I will start with this line. We had in 2011 764.7 beds per 100,000 inhabitants. And Spain, half the number, 308.9 beds. So the Austrians have the double size of beds in hospitals. We have a longer stay during this period in patient situations, but they have not the highest or the healthier society, and that is very interesting. Well, this is a disparity. A question: is there any evidence for a good and healthy health care? What does that mean? Is there any best practice model like a benchmark system? Well, questions. Well, I think it's not very easy to find answer here, and not in the rest of the time. Do I have 5 minutes more, Maite? Okay, thank you. Questions we ask in Krems in Austria to find good best solutions for the decision makers to struggle with the problems today and in the future for a better and healthier society. And well, I think all of you, we ask the same questions sometimes or every day in our home countries. But what do you think about our questions? What kind of problems we keep in mind by looking for more evidence and transfer best practice model to our country? And that was during the last years, or we had some questions and very interesting discussions and that was what we wanted to present here during the conference, the types of nurses in Austria and the roles in the society, which are, from our perspective, is different to other countries in Europe. At the basic level, Austria recognizes qualified nurses as general care nurses. We call them diplomierte Gesundheits- und Krankenschwester. And, it's a kind of educational training, which was not based in the higher or located in the higher educational sector. It was a 3-year apprenticeship at the School of Nursing. And, after this diploma level, they have the permission and they can have the license to practice. But what we have and have in this area, post-basic qualifications, only to give you some examples, after the first 3 years, they can go in a special area: infant care and pediatric care, psychiatric care, intensive care, anesthesia, renal nursing, operation department, hospital hygiene. And for all this kind of specializations, we have regulations by law. And if you want to work in a hospital in an intensive care unit, you must have a special training. Mostly it's a 1-year period after the first step. By the regulation and given by the law, national law, nurses, all those complying with the training required by the law, persons who have successfully accomplished special training, post-basic training, are entitled to add this additional title and can do their work in this area. The areas of responsibility also given by law. The scope of activity which nurses in Austria enjoy varies according to the degree of responsibility assigned to them by the law. 3 areas we have in Austria. The first is, what we call the nurse's own responsibility, and no other profession is allowed to do this. Matters of diagnosis, planning, organization, implementation, supervision, all these steps from the nursing process. And this is part only allowed for this diploma level. The second area is shared responsibility. The processes in this area include, for example, the administration of drugs, preparation of injections, and the setting of catheters. To this concept of shared responsibility requires further explanation. In this realm, the medical doctor bears responsibility for the issuing of orders. The nurse bears responsibility for implementing it. Medical doctors in Austria must order or must be given in a written form if they want to prescribe something, and the nurse wants to do this. Mostly. Matters under shared responsibility might well be of greater significance than those under the nurse's own responsibility. And the third area in Austria, we call this interdisciplinary activities, are those that concern not solely areas of care, but other areas of the health service as well. The nurse here will have the right of initiation and co-decision, and in turn, again, the responsibility of the implementation of the measures of the care. Well, the numbers and some more facts: nurses in Austrian hospitals, and we only have the data from 2008, overall about 52,000 nurses, 7,112 male, and you see more than 55,000 female. General care nurses, 45,000. Pediatric nurses is a special training where you can got your diploma in this area, and only for this area. Also psychiatric nurses, about 3,800 or 3,300. And then we have a number of nursing support helpers, auxiliaries, about 13,000, and we have our own profession given by law for midwifery and the midwives. We have about 1,200 midwives in Austria. Well, let me go on very quick. Let me talk about nursing education in this field. Nursing training, the entry requirements in this area of education was you must have 10 years school. You have to finish 10 years school. And then if you are physically and mentally and trustworthy, fit, you can enter this kind of 3-year apprenticeship. And this kind of basic education goes to the European standards, about 4,600 hours training, and by minimum 2,300 hours practical education and practical training. That was in the past. And, then we have lots of discussions in our country with politicians due to some data statistics, the health monitoring informations and things like that. And, this first level here is nursing schools, duration 3 years, 4,600 hours. Since 2004, in Austria, it's allowed to combine this traditional education together with the higher education sector. So we call this combi model, and there we have nursing schools and private universities. And they offer, it's a combi program. Since 2008, and it's not brand new, but since 2008 we have given by a law the permission to offer the nursing education only and the higher education sector. And we call this University of Applied Sciences. They're not very only research-oriented, they are practice-oriented. And this duration is, and that's Austrian law, the same timeline like the model, the old model. This program, the degree program, is 6 semesters, 3 years. This is a 5-step model, and it's not a typical new Austrian model. Well, I think it's the ICN model as well. And we have in the European area and in lots of discussions also from the ICN here 5 levels. The first level are support workers. The second are called licensed practice nurse, enrolled nurses. And then, and this is, I think for all the people who are not from Europe, interesting, due to the Bologna process, since the beginning of the, 2003, in the European countries, they described professional working areas, and nursing in the Bologna process, and we have a European, well, it's like a qualification frame. We have this in Austria as well. Are registered nurses like diploma or registered nurses, located in the level 3. And this means they must have a bachelor degree. That's the minimum for a license to practice in the future. And then we have at level 4. This is a little bit like the colleagues in the United States or Canada and Australia, and well, I think in other countries as well, called nurse specialists with specialization 1 year and with a number or size of credits. Well, and the level 5 is the level where we came since 6 years with a group from nursing students from Austria to Spain, and they are not the traditional here registered nurse students. Nurses in Austria, the group here as well as during this conference, are registered nurses, but from the old model. They have 4,600 hours, they have by minimum 3 years practical experience, and then they can jump into this area for an advanced nurse or advanced practice nurse. This is some information to this. Austria's population is, growing life expectancy, the resulting multimorbidity, as well as the restructuring of the healthcare system lead to a rapid increase of people who need nursing counseling and support, and we all know this figure with the demographic structure. Currently, advanced nursing practice undergoes a series of changes. In a long-term and extramural perspective, the rising number of elderly people with dementia symptoms are the biggest challenge for the nursing practice. Well, I think it's a worldwide problem. Professional nursing skills in caring, as well as the implementation of innovative structures, are required to safeguard high-level nursing practice, and this is also a fact and a requirement for Austria. Shorter hospital stays call for professional management structures, and you told the auditorium I have some semesters macroeconomic and business, so this is also a perspective we have to keep in mind if we think about a better or a much better healthcare system to ensure quality in support and care as well. So target group for these advanced nurses, all nurses who already dispose of 3 years of specialist professional experience at the senior level in healthcare and nursing practice. We want to enhance their nursing skills and their professional know-how, and who wish to pursue a management career in advanced nursing practice and hold mid-management position as well, patient counseling, education, and so on. The program we offer is not like the ICN model things, a master's level, because all these nurses who want to enter this program don't have already a bachelor. They have a diploma level based to the European guidelines. And so the first step, and we call this program the bridging program, to give all the colleagues the chance to jump into the academic area. But the first step is a bachelor degree. So we started this advanced nursing practice program as a bachelor program, firstly, because if we hadn't done this, and if we had started this with a master's degree, we had no students because they need a bachelor degree at first. It's a part-time training program, and it's 5 semesters, and they have a bachelor degree of science and health studies. And after that, they can enter a master's program, for example, in nursing research, and we develop this program we want to start this during the next years, and to shift the bachelor advanced nursing practice program to the master's level, I think the European normality. The general orientation is, and that's pretty new, we have the allowance since the year 2008 to offer programs for the normal bachelor nurses, and this is what we created with, we call it general nursing in Austria. It's a full-time program. The language is German, but we work on some English-spoken modules. It's a 6-semester program, and it's a difference to many other European countries. As we heard yesterday, and thank you very much for the very nice presentation, that also in the Basque country, the bachelor program has a duration from 4 years and 8 semesters. So we wanted to create also a 240 credit program, but in Austria it's not allowed. It's totally not allowed. We must offer a program with 180 credits, and it's given by law. It must have 6 semesters, so 3 years. It's a problem because it's very, very, very problematic. These kind of 4,600 hours in 100 credits. It's a workload. It's amazing for the students. Well, the key skills, and let me go on. Well, this course provides training to the higher European nursing care standards. Graduates will be licensed to work as a registered nurse, and we hope as well in the European Union they can jump to another country if they like. Nursing is the term applied to all health promotion, preventive, diagnostic, therapeutic, and so on and so on. And if you want to ask me what are the difference between the old program and the new program, well, in the old program, not located at the universities, there was a lack due to scientific aspects of nursing. Evidence-based practice, evidence-based nursing, evidence-based healthcare, these kind of content was not part of the traditional nursing preparation from the practice field. So that is brand new. And we think in Austria it is very necessary to strengthen these skills for the nurses to reflect their daily work, and also on. We had some very good examples today due to evidence-based practice and the scientific way, critical thinking, and so on and so on. Well, we're looking to other countries, and we started in 2011 a project together with a colleague from the Minnesota State University in Mankato in Minneapolis. And we did this approach 2 times, and it was called Community Public Health and Family Health Nursing. The type of primary healthcare sector, for example, you have this in Spain, is, I don't want to say unknown in Austria, but we don't have this kind of structure and facilities, infrastructure. And the focus, the nurses' focus to the community public health issues and also to the family needs is one of the most topics for us for the future. And we created and we decided a project and teaching and the research collaboration together with students from the United States. And the University of Minneapolis was the first university, I hope I'm right, they offered the first nursing bachelor program in the world. I think it was 1903 in Minneapolis. So they have lots of experience, but they're Americans. And the American way and the American system is totally different to the European and totally different to the Austrian way. But we started this collaboration, and this, to show you very, very briefly, the aim to focus of this clinical project, community-based nursing and home health care, public health concepts are applied to promote adaptation in individuals, families, and population. And looking back to the beginning of this presentation, to some problems I mentioned, alcohol, smoking patterns, and things like that, for a population that are 15 years old. And if we look to the future, all the morbidity, the problems caused to these behaviors are located by family behaviors, and this was one of the focus. Identify at-risk individuals and population groups to whom preventive nursing services should be directed. Preventive strategies. 5 minutes? 4. Okay, thank you. Provide safe and comprehensive home health care services to individuals and families to promote, maintain and restore health. Utilize the nursing process, promote, support the adaptation of individuals, families and so on. Identify issues related to health and safety within the family, occupation in school, school nursing. We don't have school nurses in Austria, so from this point of view. Apply the essential values for professional nursing in the community, and also assess the community in relation to its health, and to help the decision makers. You see this is under construction, but in Austria we started this, and it was amazing. Ask the students from our nursing program here during the conference what a lot of experience they collected during, the first group we started in 2008 with this kind of advanced nurses, and at our university in Krems we are only one we have different 5 universities now offered since 2008 the bachelor normal program for nurses. We need a number of alumni and persons from the universities, in fact, to shift our healthcare system. And that is under construction. Thank you so much. I know it's time. I know it's time for lunch. Yeah. You have a great auditorium, Maite. Thank you. Thank you very much for choosing this session and for the time, and all of you. And nobody had appeared, so great. Thank you for your attention. And it goes to you. Thank you.
Muchísimas gracias al profesor Joaquín Sulce por su presentación. Sé que ya tenemos todos hambre y que el tiempo para comer es más justito. Pero tanto Joaquín como todos los estudiantes que podían levantar sus manos están en el Congreso durante todo el Congreso, y me gustaría que aprovecharais la oportunidad para compartir con ellos vuestras experiencias y poderles preguntar. La comida, como ya os he dicho esta mañana, tenéis que salir por la puerta de entrada, dar la vuelta por la calle y entrar por la puerta contraria, ¿vale? A las 3 volvemos.